My name is Isabel Munoz,
My name is Naru Saito.
and we did our presentation on PTSD. So first up, talk a little bit about the history. Mentions of PTSD or battle stress were mentioned as early as 2,000 years ago in ancient Greece. They were mentioned by 5th century thinkers like Hippocrates and Lucretius in their poems about battle stress. The view of the disorder largely remained as battle exhaustion or soldiers' fatigue until World War I. And once it was recognized, there was still very few information on the matter, which led to inhumane and ineffective treatments such as shock therapy. The modern definition of PTSD didn't develop until around the 1970s in studies of Holocaust survivors, Vietnam War veterans, and survivors of domestic abuse. It was finally recognized as a diagnosable condition in 1980 when the American Psychologists Association included it in the Diagnostic and Statistical Manual for Mental Health Practitioners. The modern treatments were developed in the 1990s, and are still developing along with our knowledge and understanding of PTSD today.
So definition, post-traumatic stress disorder, PTSD, is an intense and unpleasant reaction that interferes with daily life after experiencing an overwhelming traumatic event. A dangerous event, such as a traffic accident or serious injury, can cause intense emotional distress for a long time. They tend to experience the event repeatedly and have nightmares. We call it flashback. And people with PTSD tend to avoid anything that reminds them of dangerous events. When something terrible happens, it has long-lasting effects on many people. In some people, the effects are so strong that they become debilitating and psychotic. In general, events that are likely to cause PTSD are those that cause feelings of fear, helplessness, and horror. Moreover, accidents, sexual assaults, and natural disasters are also common causes of PTSD. However, it can be caused by any experience that feels overwhelming and life-threatening, such as a physical violence or car accident. So PTSD is one of the most common alignments in mental health care today.
Well, in this slide, we have some statistics on PTSD. While about 55 to 70% of people will experience a traumatic event in their lifetime, only about 6% of people will develop PTSD from it. Women are twice as likely to develop PTSD as men, and more often develop it as a result of experiencing sexual violence or sexual assault, while men likely develop it from accidents, physical assault, war, or just natural disasters.
So cause. Types of events that can lead to PTSD as described on the slide include first, serious accidents like traffic accident, physical or sexual assault, abuse include child abuse or domestic violence, exposures to traumatic events at work include remote exposures, serious health problems, first experience such as losing a baby, death of loved one, war and conflict, and torture. So combat, sexual assault, and natural disasters are the main causes of PTSD, the most common of these listed. In addition, 1 in 3 people who experience bad trauma develop PTSD.
And so what are the risks of developing PTSD? Well, PTSD is known in association with a lot of other mental disorders, such as other stress disorders, depressive disorder, acute stress disorder, anxiety, or substance abuse disorder. Approximately half of people who have PTSD will also develop depression, and acute stress disorder and PTSD basically go hand in hand.
So next, risk factors. As I mentioned earlier, there are many factors that increase the risk of PTSD. For example, dangerous events or injury, seeing others hurt, seeing dead bodies, feeling fear, helplessness, no social support after the event. So these factors increase the risk of PTSD. Anyone can develop the PTSD at any age. This includes veterans, children, and people who have experienced the physical or sexual assault, abuse, accidents, disaster, or other significant events. Additionally, according to National Center for PTSD, about 7 to 8 out of 100 people will experience PTSD at same point in their lives, at some point in their lives. And as mentioned earlier, women are more likely than men to develop their PTSD. Genes may also make some people more likely to develop PTSD than others. Why do some people develop PTSD and other people do not? It is important to remember that not everyone who lives through a dangerous event develop PTSD. In fact, most people will not develop the disorder. Uh, I cannot hear your voice.
Sorry, there you go. Someone with PTSD may experience the following symptoms. They may always be on guard, so their survival instinct is likely to have been flared in this traumatic event, and because of that may remain on. They may experience negative thinking or avoid thinking of the trauma entirely. They most commonly known will have flashbacks, which can be triggered by certain phrases or sounds or events. They may also have difficulty sleeping, and this can include bad dreams and sleep paralysis.
So treatments. The main treatment for people with PTSD are medication and psychotherapy, also called talk therapy or both, because everyone is different and PTSD affects everyone differently. A treatment that works for one person may not work for another. So it is important that anyone with PTSD be treated by mental health provider who has experienced PTSD. Some PTSD sufferers may need to try different treatments to find one that works for their symptoms. First, it is treatment method using medication. The most studied class of drugs to treat PTSD are antidepressants. This can help control PTSD symptoms such as sadness, worry, anger, and inner numbness. Other medications may help treat certain of PTSD symptoms, such as the trouble sleeping and nightmares. The second, psychotherapy. Psychotherapy, also called talk therapy, involves talking to mental health professionals to treat mental illness. Psychotherapy can be done one-on-one or in groups. Talk therapy treatment for PTSD usually lasts 6 to 12 weeks, but may last longer. Research shows that support from the family and the friends can be most important part of recovery. One of the most effective psychotherapy is exposure therapy. This helps people face their fear and control them. This therapy involves imagining, writing, or visiting the place where the event occurred. Therapists use these tools to help people with PTSD deal with their emotions. So, how talk therapy helps overcome PTSD? Talk therapy teaches people helps way to react to frightening events that trigger PTSD symptoms. For example, it teaches about trauma and its effects, using relaxation and anger management skills, and offer tips for better sleep, diet, or exercise habits.
And finally, why bring awareness to it? Well, We should bring awareness to PTSD because although PTSD treatments have shown progress and have proven to be effective, many don't receive the help they need because they can't afford it or simply don't know they have it. We should also bring awareness to this because if you ever come into contact with someone having an episode caused by PTSD, whether a flashback or a panic attack, you may be, by understanding, you may be able to help them better.
All right, thank you for listening.